Can latent tuberculosis reactivate? Have you ever wondered if latent tuberculosis can come back to haunt you? Well, the answer is yes. Latent tuberculosis infection can reactivate, leading to active tuberculosis disease. When someone has latent tuberculosis infection, it means they are infected with Mycobacterium tuberculosis bacteria but do not show any symptoms and are not contagious. However, the bacteria can stay dormant in the body for years. The real concern arises when the immune system weakens. This weakening can happen due to various reasons. For instance, people living with HIV, those who have received organ transplants, or individuals undergoing immunosuppressive therapies are at a higher risk. Other conditions like diabetes, chronic kidney failure, silicosis, and certain cancers can also increase the risk of reactivation. If someone has had inadequate treatment for a previous tuberculosis infection, they may also be at risk. Recent infections, especially those occurring within the last 2 years, can heighten this risk. Lifestyle factors such as low body weight, substance use, and living in crowded environments where tuberculosis is common can further increase the chances of reactivation. The lifetime risk of developing active tuberculosis from a latent infection varies based on these risk factors. For example, individuals with diabetes and untreated latent tuberculosis have about a 30% lifetime risk of reactivation. This is significantly higher compared to those without such risk factors. Recognizing that latent tuberculosis can reactivate highlights the importance of identifying and treating latent tuberculosis infection in individuals who are at risk. This proactive approach can help prevent the progression to active disease. Treatment decisions should always be personalized and guided by healthcare professionals, who will consider the individual's unique risk factors and overall health. In summary, latent tuberculosis infection can indeed reactivate, particularly when the immune system is compromised or other risk factors are present. This makes monitoring and treatment of latent tuberculosis infection essential in controlling tuberculosis. Always consult a healthcare professional for personalized advice and treatment options.